Assalamualaikum. In this video, me and my team is going to present about heart attack rate in Malaysia. The introduction for the heart disease is one of the leading causes of death in Malaysia. This presentation highlights the death rate due to heart attack based on three data visual: a pie chart on age group distribution, a bar chart showing yearly trends from 2019 to 2023, and lastly, a line chart representing causes of heart attack in Malaysia 2015 to 2014.
So the purpose of this video is to present the number of a heart attack rate in Malaysia to illustrate the category causes of the heart attack in Malaysia. The issue is the mainly caused by blocked coronary arteries due to plaque build-up or blood clots, and sometimes by artery spasm. Risk factor includes uncontrollable one like age, gender, and family history, and uncontrollable one such as smoking, high blood pressure, high cholesterol, diabetes, obesity, poor diet, and lack of exercise and stress.
Next, we go through the impact. A heart attack can have serious physical, emotional, and social impacts. Physically, it may cause permanent damage to the heart muscle, leading to reduced heart function, chronic fatigue, or heart failure. For the background of topic, a heart attack occurs when the blood flow to part of the heart is blocked, usually by a blood clot. In Malaysia, heart disease remains the leading cause of death for both men and women, according to Ministry of Health 2023. And for our central idea is to analyze heart attack mortality in Malaysia through age-based and time-based data to better understand its impact.
The first chart is a pie chart. The pie chart shows that most heart attack deaths in Malaysia in 2022 occurred in those 60 years and above. This highlights that the risk of fatal heart attack increases with age, but it also affects younger adults, emphasizing the need for heart health awareness across all ages. As for the analysis of the data, this pie chart shows how heart attack deaths in Malaysia were distributed across different ages in group for 2022. And each slice represents an age group below 30, 30 to 39, 40 to 59, and 60 years and above.
The second chart is the bar chart, display the number of the death causes by heart attack in Malaysia from the year 2019 to 2023. The x-axis represent the years 2019 to 2023 and the y-axis indicate the number of death. The bar are uniformly colored dark red and depicts the annual number of the death. As you can see in this bar chart, the analysis of the data in 2019, the number of deaths to heart attack was approximately 80,300. In 2020, it slightly increased to about 80,500. The highest number of the deaths occurred in 2021, reaching around 21,500, likely influenced by health system strain during the COVID-19 pandemic. In 2022, deaths decreased to around 20,300, showing a slight improvement from the previous years. By 2023, the number of deaths further declined to roughly 80,200, almost returning to 2019 level. There was a noticeable peak in heart attack death in 2021, possibly due to indirect effect of the COVID-19 crisis, followed by a gradual decline in 2022 and 2023. Overall, the data show a return to a pre-pandemic mortality level by 2023. So the advantage of this bar chart is a clear trend effectively show if heart attack death generally went up, down or stay the same during the period. Second is simple format. The bar chart is easy for most people to read and understand quickly. Third is annual detail. clearly show the exact number of deaths for each of the 5 years. The weakness of this bar chart is no age. No age breakdown doesn't show how deaths are distributed across different age groups. Missing context lack information or factor that might have affected the death trends. Limited time frame only cover 5 years, which might not reveal long-term patterns. No comparison doesn't compare to other causes or location for better perspective. And lastly, assumed accuracy relies on the correctness of the reported death numbers.
And we go into our last chart, which is a line chart. So for the description of data, this graph illustrates the hypothetical trends in the percentage contribution of various causes of heart attack in Malaysia from the year 2015 to 2024. It tracks how each factors like high blood pressure, high cholesterol, smoking, diabetes, and obesity has changed over a 10-year period. Then, let us look into the analysis of data for this line chart. First thing first, we got high blood pressure, which is the leading cause and shows a steady increase. As we can see in the chart, it started at around 30% in 2015 and steadily increased to about 40% by 2024, reaching the highest percentage by 2024. After that, we also got high cholesterol, which also shows a consistent upward trend. As we can see in the chart, it grew from approximately 25% in 2015 to 34% in 2024, which shows that it is the second highest contributor. After that, we got smoking, which is the only factor that decreases over time. As we can see, it declined steadily from 20% in 2015 to below 50% in 2024. This may indicate improved public awareness or anti-smoking campaigns may be effective. After that, we also get obesity and diabetes, which are rising steadily, highlighting growing lifestyle and health issue. As we can see, for diabetes, it rose from around 10% in 2015 to approximately 19% in 2024. I believe this shows a gradual and steady increase, which highlighting growing concern. And for the obesity, it increased from 15% in 2015 to about 24% in 2024. This sharp and consistent rise is possibly due to lifestyle and dietary changes. Overall, lifestyle related causes are becoming more prominent, showing the need for public health action. After all those charts and data that have been gathered, what can be concluded is that the effective strategies require targeted prevention across all ages, detailed analysis of contributing factors, and ongoing monitoring to improve cardiovascular health outcomes in Malaysia. So this is the references for our research. So that's all from our group. Thank you and assalamualaikum. And don't forget to hit the subscribe and like button. Thank you very much.